Rabbi Rosenbaum. My name is Max Rudman, and I welcome you to a great program on memory loss, which is being recorded. It's the subject of endless jokes and deep fears. Each of us has experienced it in different degrees. If we're fortunate to grow older, our memories are challenged. Most likely, the more severe version has afflicted friends and family. Memory is central to our humanity and how we relate to each other. For some, memory slippage would create significant issues. The number of Americans living with Alzheimer's and other forms of dementia is growing rapidly. COVID isolation has accelerated cognitive impairment for many. In the time we have scheduled for this program, we will look at how to recognize when significant memory loss occurs, anticipating changes this may bring about, and dealing with them, including mitigating and slowing them down. This program is one of regular offerings by a number of organizations that serve our community. Foremost is Bikur Cholim of Greater Washington, which is known for attending to the needs of the sick and their families, and now has expanded its mission for some years now to support healthy communities through these types of programs. These programs started over 10 years ago with the support and encouragement of young Israel Shomrai Emunah's Rabbi Rosenbaum, along with others, notably also Dr. C.R. Heller, Camp Mill Synagogue, Oratora, Silver Spring Jewish Center, Chabad, and South East Hebrew Congregation are all involved in co-sponsoring this program. A word about logistics. I'm going to hear from each of our speakers and then field questions that you can send to the chat, where I will direct them to our speakers. Rabbi Rosenbaum is the host. We are fortunate indeed to have a panel of experts with extensive professional experience providing different type of care for aging and specifically dementia. We plan to share their remarks and resources they cite. We start with Dr. Lynn Deutsch, a geriatric psychiatrist who will focus on how severe memory loss is diagnosed and medically treated. After graduating from medical school in New York, Dr. Deutsch completed residency training at Georgetown University Hospital and completed a fellowship in dementias of aging from Johns Hopkins University, and has been in geriatric psychiatry and dementia care in private practice for some years now. We will then turn to Mary Ann Buckley, Director of Care Management at Corewood, a local firm. She will address the kind of planning and resources available when a condition requires different degrees of assistance. We or our loved ones. Mrs. Buckley's background is in social work, with which she obtained a master's at the University of Maryland. She has 30 years of experience in hospital settings and the Hebrew Home of Greater Washington. She is currently, as I said, Director of Care Management at Corewood. Karen Miller is the manager of the Kensington Clubs of the Jewish Council on Aging, shares insights on activities at her programs, and in general, what can be done to mitigate it. She is a certified therapeutic recreation specialist, certified dementia practitioner, altogether 25 years of working with seniors. At the Kensington Club, she works with seniors diagnosed with early stage memory loss. It was at Karen Miller's behest that Audrey Siegel, the executive director of the Bikur Cholim of Greater Washington, initiated a discussion that led to this program. And she helped identify 3 of our speakers. Debbie Sokobin, with extensive professional experience with senior adult programs at the Jewish Community Center in the Jewish Council on Aging, shares her experience as a caregiver. Finally, I've been giving the presentation now in the order of the remarks. Senior young Israel Shomrai Emunah, Rabbi Dovid Rosenbaum, a member of our community for many years and senior rabbi since 2010, gives us some halachic and spiritual insights from the Jewish tradition. We'll turn now to Dr. Deutsch. Thank you.
Thank you, Max. I'm going to discuss the early diagnosis, workup, and medications for memory loss. These are the points to remember. The medical perspective is now focused on very early intervention and treatment, because we've learned over the past 30 years that the brain changes occur years before the appearance of memory loss. The current medications are more likely to slow progression when they're given early in disease, And so that is why the focus is in identifying people very, very early. I want to highlight that the differentiation between normal age-related changes, mild cognitive impairment, and mild dementia can be difficult, and it requires a baseline assessment and follow-up. It's important for all beneficiaries of Medicare to note that in their annual wellness visit, the primary care provider is actually required to check for cognitive impairment. So the first place that somebody can go to is really the primary care provider, and they can use a screening tool to see how someone's cognition is at that point in time. Medicare also covers a more comprehensive cognitive assessment and written plan of care. This next slide shows the Montreal Cognitive Assessment, or the MoCA. This is a very standard screening tool that I use frequently, that many other people use, although there are other screening tools to assess in the office very quickly the different cognitive domains. So it isn't just memory. We refer to memory, but memory loss is usually associated with other cognitive changes. So this kind of a screening test gives us information about visual spatial function, naming, which is language, memory, attention, language, abstraction, and delayed recall, as well as orientation. And based on this screening, I can tell whether we need to proceed with further investigation. So what are the normal cognitive changes with age? I want to emphasize that there is a lot of individual variability because everybody has their own particular strengths and weaknesses. However, there are changes in processing speed, working memory, executive function, finding words, and remembering names. These are considered to be normal aging changes. They do not interfere with daily functioning. Also, on a positive note, vocabulary, reading, and verbal reasoning are unchanged, or they actually improve with normal aging. What is mild cognitive impairment? This is a condition which causes slight but noticeable changes in memory and/or other cognitive abilities, which are not severe enough to affect daily functioning. It may represent a stable condition or the earliest stage of Alzheimer's disease. There's no medications that are indicated for MCI, except if it's diagnosed as MCI-AD, and that would be the very, very earliest stage of Alzheimer's disease. Cognitive screening and neuropsychological testing is very helpful and important in quantifying mild cognitive impairment. There's no way to know exactly from history. And it's important that once this is diagnosed, that patients have serial follow-up, because we have to ascertain whether there is a progressive decline. What is dementia? Dementia is a generic term for a decrease in cognitive abilities. The most common form of dementia is Alzheimer's disease, but there are other forms of dementia. In Alzheimer's disease, there are pathological changes. These are characterized by deposition of amyloid plaque and neurofibrillary tangles in the brain. Clinically, Alzheimer's disease is characterized by amnesia, memory loss, aphasia, which is language deterioration, agnosia, which is visual, spatial, and perceptual decline, so that people are unable to recognize objects, people, their family, themselves, and apraxia, which is inability to carry out previously learned motor activities. So this leads in the later stages to the inability to dress oneself, or to brush one's teeth, or to know how to use a hairbrush. I want to mention that there are also non-cognitive symptoms of behavioral changes of psychosis, depression, and anxiety. These are not cognitive, they're non-cognitive symptoms, and they accompany the cognitive changes. The less common kinds of dementias, there are other neurodegenerative dementias, such as Parkinson's disease, Lewy body dementia. This presents with prominent hallucinations and fluctuations in cognitive ability. And there is frontotemporal dementia. This is important because it's the most common form of dementia in patients below the age of 60. Vascular dementia is less common, but it's often present with Alzheimer's disease. More than 50% of patients who have Alzheimer's disease will also have vascular dementia. And this is dementia that comes as a result of small or large strokes. We also have classification of reversible dementias, and included in this is pseudo-dementia of depression. Now, these reversible dementias are treatable. So we treat depression, and then the cognitive impairment disappears. We also look for B12 or folate deficiency. Normal pressure hydrocephalus is a buildup of fluid within the ventricles of the brain that the fluid can be shunted, and theoretically the dementia can be improved. Sleep apnea can cause a dementia. Hypothyroidism, infections, and medication induced, like sleep medication, Benadryl, antihistamines. We also have to distinguish dementia from something called delirium, which is a common, potentially treatable and reversible decrease in attention, concentration, and memory. And it's usually related to surgery or medical illness. I should say that patients with dementia are the ones that are most likely to have a delirium. Okay, so in the office, what is the workup? It's very important to take a detailed history of the current illness. That's a history of the memory loss from both the patient and the informant. The informant has to be a family member or a caregiver, somebody who knows the patient fairly well. And it's very important that I have background about educational level and occupational history, as this tells me what is strong in that individual person's brain. I review medical history, past psychiatric history, family history of memory disturbance, review all medications with the doses, prescription as well as non-prescription. I perform a brief neurologic exam and a cardiopulmonary exam, and do a screening exam, such as the MOCA, the Montreal Cognitive Assessment, and a geriatric depression scale. The laboratory workup, which is needed, is really to rule out these reversible causes of cognitive decline before we say that someone is suffering from a neurodegenerative dementia. So we have to look at chemistries, which are liver and kidney function, thyroid. We look for anemia, again, the B12 and folate. We check a urine. There's many other additional lab tests depending upon the history. And the imaging of the brain is very important to rule out reversible causes. A CT or MRI scan of the brain can tell me about subdural hematomas, which are bleeding in the brain. Sometimes after a fall, I can see if there's a brain tumor, a benign meningioma, or a more serious brain tumor. I can see on MRI, I can see the level of stroke, whether there's small, tiny strokes deep in the brain or larger strokes on the surface of the brain, in the cortex. Sometimes I've seen fluid build up as a cyst in the brain. And also this normal pressure hydrocephalus will show a buildup of fluid in the ventricles. So it's very important to image the brain. Then neuropsychological testing is done by a specialized psychologist, a neuropsychologist. It can be done now virtually or in the office. It's a much more detailed and lengthier assessment of all the cognitive functions. But it's very important to obtain the profile of it will lead us in the direction of what kind of dementia this is. And it's very important to establish as a baseline for the future. I'm just going to talk a little bit about Alzheimer's disease since it's the most common form of dementia, and review the risk factors. Age ongoing aging, and genes are the most important risk factors for Alzheimer's disease. I think it's important to educate you that there are two forms of Alzheimer's disease. There is sporadic Alzheimer's disease. This is the most overwhelming, the most common form of it. Then there is early onset familial Alzheimer's disease, which accounts for only less than 5% of all AD cases. In sporadic AD, what they have found is that the ApoE4 allele, which is a form of the apolipoprotein E gene, which is responsible for packaging cholesterol and other fats, is the presence of this allele is associated with an increased risk for Alzheimer's disease. There are other forms of it, ApoE2, 3, and 4, and it's only the 4 that's associated with the risk. The 25% of the population carries 1 copy, 2 to 3% of the population have 2 copies, but I want to emphasize it increases risk. It does not cause the disease. Early onset familial is associated with other chromosomes and a variety of them. And this form of it, you can present with patients even in their 40s, 50s, and 60s, much earlier than sporadic AD. Okay, I just want to review the lifestyle changes which help to reduce risk. Activity, physical exercise, I cannot emphasize enough. Being sedentary is lethal. Being sedentary today is like smoking. Physical exercise daily, aerobic activity, weight-bearing activity. It's good for the heart, it's good for the brain. Cognitive exercise, reading, word games. Everybody's doing Wordle. I love it. Spelling bee, learning new skills, very important to challenge the brain. Minimizing smoking, no smoking, minimizing alcohol, maintaining a healthy body weight, diagnosing and treating hypertension, atrial fibrillation, elevated cholesterol, prediabetes, and diabetes. Very, very important to protect the brain from small areas of stroke. I just want to mention with hypertension, it's very important. The American College of Cardiology has come out that blood pressure really should be 120/80 or less. So it's very important, even when you start medications for blood pressure, to monitor that and make sure that the blood pressure is staying at that range. Okay, what are the medications for dementia? There are 4 medications, oral medications, that are approved by the FDA for Alzheimer's disease. The goal is that they slow progression, they help to maintain cognition, as well as functional activities of daily living. They do not change the pathology, they do not restore memory. They need to be given as early as possible. 3 medications in this one class of cholinesterase inhibitors. You've probably heard of them: donepezil, galantamine, rivastigmine. Rivastigmine or Exelon is also approved for Parkinson's disease. The other medication we use is Namenda, memantine. It's an NMDA receptor antagonist. The gold standard is to give both medications together. I usually start them sequentially, though. I will start with a cholinesterase inhibitor and then add in memantine. Currently, most of the trials are focusing on using monoclonal antibodies, which target this amyloid beta production, aggregation, or clearance. The first medication to act on the actual pathology in AD received FDA approval last year, and it's called aducanumab or Aduhelm. It received an accelerated approval by the FDA because some of the results were conflicting in terms of whether it actually slowed decline in these patients. It was shown to remove the amyloid, but some of the studies did not show that it actually had an effect on cognition. However, it did receive accelerated approval because it's really an emergency to try to find medications to prevent and to slow progression in Alzheimer's disease. So it has been given. Recent data just from this month show that when it was given over a 2-year period, there was sustained reduction in the amyloid buildup in the brain and was associated with less clinical decline. It's given as an intravenous infusion, and patients have to demonstrate, they have to have a special kind of PET scan, an amyloid PET, that shows that they in fact have this amyloid buildup in order to receive the infusion. There are side effects. The side effects clinically can be headache, dizziness, nausea, and they are correlated with some swelling and hemorrhage on the brain that we see. So patients require serial MRIs to identify these side effects. I want to mention other medications that are used for behavioral symptoms. We use antidepressants for depression, anxiety, and even just agitation. We use antipsychotics for aggressive behavior, hitting, biting, throwing objects, and for paranoia. But there is a black box warning saying that they're not indicated for use in dementia patients. However, we do need to use them at times. And then there is another medicine called Pimavansarin that's a novel antipsychotic, and it's approved for use in Parkinson's psychosis. So in summary, do not dismiss concerns about memory or other cognitive changes, especially if they're mild. It's important to obtain a screening with the MOCA or a baseline neuropsych testing for future follow-up. If dementia is diagnosed, it's important to clarify the specific type and whether medication is indicated. I think it's important to consult a memory disorder program at an academic medical center. My colleagues on this panel will discuss the non-pharmacologic treatments, and there are many: adult daycare, assisted living, memory care, home care routines, and caregiver support. This final slide shows the resources in the Washington-Baltimore area. Dr. Scott Turner he's the director of the memory disorder program, and it's within the neurology department at Georgetown. They have a very, very excellent program, and they're really happy, I think, to see the worried well, people that really don't know what's happening. They conduct research on very early changes with memory. It's an excellent resource. There is a memory clinic at GW, and as well as at Hopkins. Over the past 30 years, they've been pioneers in diagnosing and treating dementia in all stages. This website is the Medicare website that talks about what a Medicare beneficiary can receive. And this site is from the University of California, San Francisco. They have excellent educational videos that elaborate on much of what I've discussed today. So thank you very much for your attention.
Thank you. Thank you, Dr. Deutsch. Appreciate it. Okay, move on now to the next speaker, Ms. Butler. You've stopped sharing, right, Dr. Deutsch?
I stopped sharing.
Okay, so. Turn to you. Yeah. Okay, great.
Is this good?
Yep, you got it.
Okay, thank you so much.
You're on.
Okay. Thank you so much. I'm honored and excited to be here, and thank you, Dr. Deutsch. There's so much of what you said just combines with what I'm saying, and I really appreciate this. So I'm taking it from the look at, you've been to see Dr. Deutsch with either yourself or a family member, and now what do you do? Max, can you see the black thing that's on the PowerPoint across the middle, or no? That's just what I have.
I don't understand what you mean, the black. Yeah, I
Marianne,
yes,
that's just you.
yeah,
It's
your
just
point,
you.
your
That's just
pointer
me.
is working. Your pointer is working.
Okay.
Yeah,
Okay.
yeah.
Okay. So you've noticed change in your memory. What should you do? Thank you to Dr. Deutsch. Don't assume it's just a natural part of aging. Be proactive. Go see your doctor. And as she had said, when she does an exam, she wants the exam, the consultation with not only you, but with family and friends, because oftentimes we don't notice the changes in our memory as well, or we think we're managing everything well, and yet our spouse, our daughter, our best friend or something like that could really be helpful in that. So check with others to say, have you noticed any differences about my memory? Knowledge is power. So learn about brain health, do some research, talk with other people. So that's the next step. You've noticed it. Now what are you going to do? So for most people, you've gone to see Dr. Deutsch, or in my slide, I have GW in Georgetown. So we're right on the same track with kind of the large medical settings. Teaching hospitals that have memory disorder clinics are a great option for people. But, take time to process the information. If you've been given MCI or whatever the diagnosis is of dementia you've been given, take some time to process this. What does this mean for me? What does this mean to my relationships? And how do I want to live my life? Because the last thing we want people to do is to shut down and ignore it, or not take action. It is overwhelming when you've been given that. Our memory is such a key and vital part of our life, but what are we going to do with it? Take control of that. If you were given a diagnosis of another illness or something, it might look very differently. So people like Karen and myself and Dr. Deutsch were wanting people to say, it's okay. You have to make plans just as you would if you got a cancer diagnosis. You talk to your family members, you make plans, and you move forward. So that's kind of what we're wanting to propel people to do. The range of emotions, this is from Dr. Elizabeth Kubler-Ross. You might have denial. It's okay. I don't have that diagnosis. My spouse just says I do. Anger, bargaining, depression, acceptance. You can go through a range of emotions when you're diagnosis. But again, our goal is to encourage you to read some books, read some articles, look to national organizations. I have that on my resource page, the Alzheimer's Association, the Alzheimer's Foundation of America. Have conversations with those you love and trust about what's going on with you. They need to talk to you about it. You need to talk with them about it. So making these plans, change is inevitable, right? And I put this in here. Advanced care planning. April 16th is National Healthcare Decision-Making Day, where 12 years ago, someone decided that we need to bring this to the forefront and make sure people do their advanced care planning. Medical decisions. If something was to happen to me, I step out on the curb, I get hit by a car, and I go to the hospital. Who could make that decision for me? And I think what's important is we look back the past 2 years with the pandemic, a lot of people didn't make these plans. And so the outcomes were differently. I encourage people to do the advanced care planning, which is an advanced directive. Who's going to make my medical decision for me? That part of that is a healthcare power of attorney. If I can't speak, who will speak on my behalf? Or it's the living will, which is a document. A great document, and I have it here. It's called the 5 Wishes. A nominal cost. It's allowed in the state of Maryland. It's a great discussion point for family members. What would I want if? What would I want if I couldn't talk? What would I want if I no longer am eating? It kind of takes you down that path of really getting deep into the conversation so that you can think about it, you can share with your family members, certainly discuss with your doctor. Maybe there's certain things with your health situation are more prevalent than others. I say encourage people to make a will. Oftentimes the advanced directives, I'll just go back to that a minute. I work with so many couples where the husband and wife are each other's power of attorney. Only when I meet them, let's say the husband has advanced dementia, he can no longer be his wife's power of attorney because he's unable to make decisions for himself. So it's a great time to look over these things. Yes, I put in here, make a will. If you haven't had that, maybe all of you have, I commend you. I put this in because this was a couple years ago. In 1 week's time, I met two different gentlemen who became our clients who were both in their 90s, both were attorneys, and neither of them had their own will. So sometimes those who in the business don't do what we tell people to do. And of course, funeral plans. Financial. The cost of care is costly. Karen will talk a little bit about this as well as I, and the different options. You might want to consult a financial planner, educate yourself and learn about the cost of care. Do you have a long-term care policy? And what does that mean? What is the elimination period? What do you need to do to open the claim to get that reimbursement? Are you a veteran? There's something on my resource page for there. And just know that there is county assistance as well. Daily life, touched on by Dr. Deutsch, you're going to likely be needing assistance with bill paying, with driving. These are kind of the things she talked about, everything from the activities of daily living, which are taking care of yourself, hygiene and things like that, as well as the instrumental activities of daily living, which is the driving, scheduling appointments, managing your medication. I added on this identification. Let's make sure people who have a form of dementia can either wear a wrist ID or have something in their wallet with identification. The idea is to keep folks safe within their home as well as within the community. I will go to Karen will go further into this, but learn some of this, but learn about care options, memory cafes. Karen will speak on adult day programs. You can actually bring care into the home, a caregiver to come into the home. It can be as minimal as 4 hours a day, once a week, or it could be all the way up to 24 hours a day, 7 days a week. There are small assisted living homes, which I think are it's all dependent on the person and a lot of things, right? Your budget, what you and your family's wishes are, goals and things like that. There's also assisted living, independent living, nursing home. You can call any of these places now. Most of them are giving a tour. So you could, do your homework, think ahead and take a tour just so you know. In my work with older adults for the past 30 years, I've realized that so many people, have feelings about these facilities or communities, but it's based on old knowledge. Well, I never want my spouse to go to a nursing home because of the nursing home I visited when my grandmother was alive. Well, that was many years ago. So, go and check these things out again. For emotional support for you, let's say I'm the spouse and my spouse has memory loss, both of us would benefit from a support group. Learn from others, gain that support from others. Certainly there's counseling, therapeutic counseling. Dr. Deutsch talked about medications. There's a 24/7 helpline with the Alzheimer's Association. It doesn't, remember, you could substitute the word dementia for Alzheimer's Association. It's all types of dementia. She had mentioned exercise, sleep hygiene, build a support team around you, whether that's neighbors. I've seen wonderful neighbors helping neighbors. There's also the village movement, which is a geographical area where you become a member and you can ask for support, somebody to go to get you groceries, pick up medications, put a light bulb in that's burnt out, shovel the snow, things like that. For many of us are in religious or faith or spiritual communities, that can be a great source of not only emotional support, but maybe help with some things that you need help with. I couldn't resist adding some statistics in here, I'm sorry. This was very powerful to me. The care of dementia is actually the care of two people. The person with the illness and the person taking care of them. So not only do we want to focus on the person with dementia, but we also want to be mindful and be concerned about the person who's the primary caregiver. Primary caregivers happen to be largely women. 73% of people age 75 or older have dementia, Alzheimer's, and 30% of caregivers are 65 or older. At a point in life when we're not really maybe able to be caregivers, a lot of people are in that stage, are called in to be a caregiver later in life for their family member. So my call to action is to ask for help when you, and I just want to push this, say this, and I know Rabbi will touch on this, but when you help someone, let's say Karen, who I've known for many years, says something to me and something is going on with her, and I decide I'm going to make Karen a casserole. I'm going to make her a meal because she's got some family issue, and I'm going to show up at her house with a casserole. And she will probably say, oh, you didn't have to do that. That's really helping my brain health. It releases good endorphins in my brain when I'm giving help, right? So in essence, I say this to my mother all the time, who says I shouldn't help her. And I said, no, Mom, by helping you, you're really helping my brain health. So for those people who are resistant to help, you can tell them they're helping your brain health. Be specific with what you need. This is time and time again, the thing that I learned. If you really, and ask the grandchildren for help if you need it. Ask the neighbors. People are willing to do this for you. Chances are you've helped them a lot. So return that, but be specific. If you really don't want to take your spouse who has memory loss to your medical appointment, call that family member and say, hey, Karen, next Tuesday at 3 o'clock, can you come over and sit with Bill when I can do this? Don't leave it kind of open-ended. People like to know to put into their schedule when they can help you. Laughter is the medicine. I'm going to leave you with one short story that a woman gave me who had a husband years ago, was diagnosed with FTD. And she told me once that he never, ever liked her singing. Throughout their married life, he never wanted her to sing on the radio. He didn't like her voice. So she said when he would become agitated as his illness progressed, they would go for a ride in the car, and one day she turned up the music and it was a song from their younger years, and she was just singing this song and he sang it with her. His speech was deteriorating, but he knew the words and he sang it with her, and he didn't tell her not to sing. So look for positive points. I also say you can't pour from an empty cup. So you caregivers out there, you need the support and building that support team. Resources, I've given you the number to the Alzheimer's Association, the Alzheimer's Foundation of America. This, by just letting you know, this is this much of resources that are out there. I tried to gather a few for you, but there's so many great resources out there. If somebody that you have, your loved one is a veteran, check out the aid and attendance pension benefit. Montgomery County, of course, has the Aging and Disability Resource Unit. The Beacon newspaper, there's the Senior Resource Guide, which is wonderful. There's the Guide to Retirement Living source book. I gave you information about the 5 wishes. You can turn to Maryland Care Manager, which is what I do. There's many in the area like me that do what I do. There's the website to find one in your area. Pazita Vive, who's the village coordinator for all the villages in Montgomery County. It's worth giving her a call if you don't know if there's a village in your neighborhood. The last 2 are Georgetown and GW, but I also wanted to add, I took a tour of the Medstar Health Center for Successful Aging, and I commend that name because I think words are powerful. It's over at Montgomery General in Olney. They have this new center for successful aging, and they bring in a social worker, a physical therapist, cognitive testing, pharmacy, kind of a one-stop shop, and I'm pretty impressed with that. And thank you. I'll just say you are not alone. Communication is key with family members. Let's make sure we talk about this. Reach out for assistance and be well on this journey. Thank you so much.
Thank you very much. Thank you very much, Mary Ann Buckley. Thank you. Okay, if you stop sharing, we can turn now to Karen Miller. Thank you very much.
I'm gonna figure that stop share. Yes.
Thank you. Thank you.
All right, thank you so much. I think what I'm going to do before I start my slide presentation is I want everyone to take a deep breath in and out. We've gotten a lot of information from Dr. Deutsch and Mary Ann, and I want you all to know that we're going to get through this hour and it's all going to be good. So take your arms, reach them up, reach up for the sky, reach. Make sure you're breathing and down. And let's just do that one more time. Reach up, reach, and down. Okay, so now I'm going to share my screen and do my presentation. All right, can everyone see my slides okay?
Yep.
Okay, I'm going to start my slide presentation. Okay. So I'm going to talk about how to stay actively engaged in your community once you've gotten that diagnosis, because like Dr. Deutsch said, and like Mary Ann said, it's real important to stay active. You don't want to just sit at home. You don't want to just become sedentary. You want to get moving and you want to stay active. And we're going to talk about how to do that once you've been diagnosed with memory loss. A little bit about myself. My name is Karen Miller. I'm a certified therapeutic recreation specialist and a certified dementia practitioner. I've been working with seniors for over 25 years, but I'm only 24 years old. So I'm not quite sure how that all happened, but they tell me I've been working with seniors for 25 years. So currently I am the manager of Kensington Club, which is a social day club for seniors diagnosed with early stage memory loss. We have 2 in-person locations, one in Rockville at the headquarters of the Jewish Council for the Aging, and one in Silver Spring at the White Oak Senior Center. We also, since COVID, have had an online virtual program that we call Kensington Club at Home, where we offer 20 to 25 Zoom programs for our members over the internet, over Zoom, over a 6-day period throughout the week and throughout the month. So we have Zooms every day but Saturdays. So we offer in-person programming and Zoom programming. And I don't think we're going to stop our Zoom programming. It's working and it's going well. Prior to working at Kensington Club, I've worked in long-term care and I've also worked in care management. All right, so we're going to talk about how to stay physically, cognitively, and socially connected. All right, so we all know what a toolbox is, and our toolbox is empty. And hopefully today, after, your toolbox will be filled with lots of knowledge and ways to stay involved and engaged. So let's start with physical connecting after memory loss. Dr. Deutsch said it's important to stay active. You don't want to just sit on the couch and be active turning your remote control button, okay? My dad will tell me he does exercise every day. I said, Dad, what kind of exercise do you do? And he says, I turn the channel on my remote control. Well, that's not active physical activity. So you want to stay active as much as you can. Now, of course, that's going to change once you've been diagnosed or as your diagnosis progresses. So if you can only exercise for 30 minutes a day, that's fine. If you can only do 15 minutes at a time and do 15 minutes twice a day, that's fine too. You want to exercise no matter what your stages of dementia. And what is the right amount of activity? Well, that's going to depend on you. And they say, 3 to 5 days a week of 30 to 40 minutes of activity is good. Now, why do you want to do exercise? There's many benefits to exercise. It helps manage your blood sugar. It helps your blood pressure. It improves your mood. It makes you feel better, okay? And it also keeps you thinking, learning, and with good judgment skills. And you have fun doing it. But I do want to mention that before you start any type of exercise program, it is very important to check with a doctor first, okay? Do not start an exercise program because any of us told you to do it. Please check with your primary care and make sure that if you're going to start a yoga class or a Zumba class, that you can do that, okay? And it's really important to do an exercise that you like to do. My dad was a bowler for his whole life. So he likes to bowl. That's a great type of exercise. And no matter what your diagnosis, you can modify any type of exercise to meet your needs. There's gardening, there's walking, there's balance exercise, there's seated exercise. You can do balance exercise and seated exercise with or without weights. There's online exercise classes. There's Zumba, there's yoga, there's Tai Chi. There's lots of different types of exercise classes, and you might want to try something new. It's always good to learn something new, and you're never too old to learn something new. All right. So here's just a fun little thing from the National Institute on Aging. Being active, spending more time with family and friends, and learning new skills also can help you feel better and improve your memory. It's obviously going to make you feel better if you get out, get up, get moving, and get active. All right, moving on to cognition. All right, obviously, a diagnosis of memory loss is going to affect your cognition, but there's many things that we can do. Dr. Deutsch talked about different word games. There's Wordle. I can't even do Wordle nowadays. I think I need a lesson on Wordle 101. But there's many word games. There's crossword puzzles. I was meeting with someone last week at the White Oak Senior Center, and she's got memory loss, and she said she does the crossword puzzle every day in the New York Times. Well, I can't even do that. So she's a step above me. So I'm impressed. There's board games, tons of board games out there. There's reading, there's gardening, there's online cognition games. One's called freerice.com. I love that. We do it with our members. And also doing things with your non-dominant hand. This is all good for your brain. This all helps with problem solving. The one thing you have to remember is that once you have a diagnosis and you're playing these games or doing these different word games, things are going to get more challenging. So you might need to adapt the way you do things, and that's okay. If you used to be able to do a crossword in 20 minutes and now it takes you 40 minutes, that's okay. You might have to break it up, spend 10 minutes doing it and come back to it. Take a break in between if you need to. None of these games have to be done perfectly. Obviously, we know how to play dominoes, and you're supposed to connect the colors and the numbers, but maybe you just one day connect the colors, and that's okay. It doesn't have to be a perfect game of dominoes. And in Scrabble, you might not spell the word 100% correctly, but that's okay. You're doing your best and you're giving it your effort. Your attention span is going to decrease, like I talked about. If you played a game for 40 minutes before and you can only do it for 20 minutes, that's okay. On here, my number 7 talks about using your non-dominant hand. There's many benefits to using, I'm right-handed, but have you ever tried writing with your left hand, or brushing your teeth with your left hand, or brushing your hair with your left hand? These are great connections, and it will help your brain stimulation. All right. This is just a cute little quote. If you want to boost your brain, you have to focus your attention on good self-care. You have to take care of yourself at all times. All right, socially connecting. Obviously, this is a big thing that I talk about, being a manager of a social day club. I want everyone to be social in their interactions on a daily basis, but this can be done at community centers, senior centers, churches, synagogues, temples. You can volunteer. It's never too late to volunteer. You can do one-on-ones. You can go to a support group or a memory cafe by the Alzheimer's Association. You can do a social day club for early stage memory loss, which I manage right now. And this is a quote by one of our participants that says, "It's hard enough losing your memory and abilities without losing your friends as well." Okay, so think about that. We know that you're losing your memory. We know that you're losing a lot of your daily functioning abilities, but you don't want to lose your connections with your friends and your families. That's really important. All right, so a little bit about Kensington Club. Like I mentioned, this is a social day club for seniors with early stage memory loss. I mentioned we have 2 locations. This is just a resource for you. We are located in Rockville and in Silver Spring. And then, of course, we have our online program also. Another resource is the Friends Club, which is a social day club. Same type of program, but this is for men only. So this is in Bethesda. Then you have Club Memory. This is a great program, and they're starting to meet up again in person, I think, soon. This is for the person with memory loss as well as their caregiver, okay? And it's called Club Memory. These are some virtual art talks that have started up since COVID. And I met with the director of the Access Smithsonian one, and she says they will never stop them now. Once they started them, they're never going to stop them. So there's Just Us, which is the National Gallery of Art, and also the See Me, which is done through the Smithsonian. And these are great programs for people with memory loss as well as their caregivers. Marianne touched briefly on the memory cafes, which are done through the Alzheimer's Association. These are free. They are starting to meet up again in person, but they also do continue to do virtual ones also. And there's some in Rockville. They're all over Montgomery County and all over Maryland too. But the ones I talked about are in Montgomery County: Rockville, White Oak, Leisure World, Oasis Memory Cafe, and then the virtual one in Olney Library. And those are done through the Alzheimer's Association, and therefore the caregiver and for the person with memory loss. And the one thing I want to say is the beginning is the most important part of the work. Okay, you are not in this alone. We're all in this together, and we're all here today for a resource for you and to help you get started once you have that diagnosis. And I do want to just talk about Respite Care. Kensington Club obviously is I mentioned, we're a social day club for seniors with memory loss. We're a 4-hour program for the member that has the memory loss, but we also provide a respite service for those caregivers so they can go out and do what they want on their own. I had a wife who was getting chemotherapy, and she would drop her husband off at Kensington Club, go get her chemotherapy, and then come back and pick him up. One day she came in and she had her nails and her toes all done. And I said, "Wow, your toes look gorgeous." And she said, "Yes, I felt so good about him being here. I decided to go do something for myself." So it's really important to take care of yourself through this process. You're not alone, and we're all in this together. Again, here's just my contact information through the Jewish Council for the Aging Kensington Club. And Max has that as well if you ever have any questions about what we do and what services we provide. And that's all I have, Max.
Thank you, Karen. This is very helpful. I appreciate you also bringing a lot of people together so that we can have this program with different perspectives. So if you stop sharing, we're going to turn on now to Debbie Sokobin. Maybe you can help her with the flyer. Okay, great.
Thanks, Karen. Sorry, I have a cold, everybody. Glad this is virtual. So Karen started with breathing. A wise therapist once, long before I became a caregiver, instilled in me the importance of breathing. And I think that goes hand in hand with patience, because as a caregiver, patience is you have to dig deep. A little background, my parents lived in Chicago their whole entire lives. My father passed away in October after a brief illness, unfortunately, and I live in DC. I have a brother in New York and a brother in Portland, Oregon. So as I like to say, being the favorite child, and only daughter, I knew that my mom had to come here. She has Alzheimer's. And while my dad was sick, she experienced a definite decline in her cognitive abilities, zero short-term memory, and she didn't want to come live with us, but she knew it was what she had to do. One thing, speaking as a caregiver, and I'm sorry if I repeat some of the things Marianne and Karen both brought up, every situation is different. It's very hard for me to speak to what everybody on this Zoom or anyone who's a caregiver is experiencing, because dementia takes so many different forms and manifests itself so differently within a family and within the individual. So it's very hard to say what caregiving looks like for you, for me. But it's so important to find a village and try to accept the help from a village. Excuse me. If people offer to cook for you, as Marianne said, stay with your loved one while you run an errand, or just get a much needed break, a massage, a pedicure, whatever makes you happy. See a friend for lunch. I find that finding private moments for myself is the biggest challenge, because my mom and I, we've always been very close. And now that it's her, my husband and me in the house, she likes to be busy and she likes to follow me around. I am still trying to run a business that I launched right before my dad got sick. So it's been a bit of a juggling act. If you can find a support group, that is, even if it's a friend to talk to, an organized support group is wonderful. Just so you know that you're not alone. It makes a huge difference. It can also be just talking to a therapist. It doesn't have to be a group. Going on a walk with a friend, venting helps a lot. Is also tied to self-care. That is hard when you're living with your loved one, but if you can send that person to Kensington Club, go take them to an adult day center. I know there are some in various religious communities, different ethnic communities. It gives you a breather, and that's very important. And self-care looks different to everybody. And then my last point, and I know it's hard to see, is don't lose sight of your loved one's essence. It's so hard to have a conversation with my mom because her short-term memory is gone. So we can't talk about what's going on in the news or I can talk to her about what's going on, and she's very present and very appropriate in her responses, but there's no carry through. So if I talk about my daughter and her new job, we have to start at the beginning. What she's doing, where she's living, is she happy? And it's a lot of repetition, as I'm sure many of you are aware. But if you can find something that brings your loved one joy and satisfaction, we like looking at old home movies, listening to music, doing puzzles. She's a big crossword puzzle person. Loves gardening, cannot wait for spring to actually be here. For her, she even says it's therapeutic for her. So it's something she can do on her own because she doesn't wander. I'm very blessed. She won't leave my house and walk down the road. Those are all wonderful things. She likes to help doing the dishes. And as Karen said to me recently, so what if the dishwasher is loaded inside out and backwards? Let her do what she can, because then she feels like she's contributing to the household. She keeps offering to help me get ready for Passover. And I know if I let her do a task, I'm going to have to be right there, but at least she feels like she is being productive. But one thing, the last thing I want to say is we interviewed a caregiving agency, and it was on Zoom. And the director of the agency happens to be from Chicago, and he's young. He's one of my brother's ages. And my mom happened to ask him where he went to camp. What prompted that, I don't know. He mentioned an arts camp, and my mom blurted out, I went to a program when I was in elementary school, after school, 2 days a week, and it was this family's program. I went with my cousin, and I was the female lead in Guys and Dolls. This was a story I had never heard. My mom was 20 when I was born. We basically grew up together. I thought I knew everything about her, and I realized that my mom put herself last throughout her life. She had a career. My dad came first. My brothers and I came first. And it just made me so happy to hear this story that she would never have shared, because she wasn't going to put herself, talk about her accomplishments. She only wanted to hear about our accomplishments. So just know that the essence of your loved one is there. It may come through in a story, a smile, a glance, but it's just something to keep in mind. And I wish everybody lots of luck. It's a challenge, but it's worth it.
Thank you,
Thanks.
Debbie Sokobin. We appreciate all your remarks. Very touching. If you can stop the sharing, we can now turn to Rabbi Rosenbaum. Thank you. Rabbi Rosenbaum?
Thank you very much. First of all, I'm sure I'm speaking on everyone's behalf. Big thank you to all the panelists. I think this was a wonderful, wonderful program. And on top of that, a big, big thank you to Max Rudman. All these programs really come thanks to Max's tremendous devotion and dedication. And thank you to everyone for joining us today. Really just a few very basic points, most of them echoing, maybe with a slight rabbinic twist. I think Marianne was the one who spoke about not being hesitant to ask other people for help. I've been scanning through the participants. The vast majority of the participants are from our wonderful Kent Mill community. And I know so many of you personally, and so many of you are people who have given and continue to give to people in all kinds of ways. We are very reluctant to ask other people for help, but we know ourselves, we've been so happy to help other people. Sometimes the shoe is on the other foot, whether it be a person who's experiencing memory loss, whether it be a person who's a caregiver. There are so many people in our community who have said to me before, they would love to help so-and-so, but they don't even know how to. And maybe they've asked before what they can do, and people, thank them for the offer, but decline. As has been said, it's a great way to help ourselves, and it's a great way to really create this circle of giving. It's part of being in community. Just please keep that in mind. One comment that I get from many people who are caregivers as children, is the terrible difficulty a person feels like their parent is no longer there. The parent that they knew all these years and decades and have loved so much, they feel the parent is gone. And and obviously it's a terribly difficult situation, but I think it's worth remembering that the beautiful mitzvah, the beautiful commandment we have in the Torah of kibbud av v'em, of honoring one's parents, is most applicable in such a difficult type of situation. The Talmud explains that what it means to, at its core, what it means to honor a parent is to provide food for them, to provide clothing for them, to provide for their basic needs. Sometimes we're in a position where we do it ourselves. Sometimes we're in a position where we're making sure those things are taken care of. And obviously the kind of circumstances we're discussing are remarkably difficult. But if we can galvanize the emotional strength and sometimes physical fortitude to do these things, we're doing a great mitzvah for our loved ones. And we're also sort of completing a very powerful circle. In many situations, these are the type of things that these people did for us when we were much younger, and now we're doing for them. And in many cases, our own children, perhaps adult children, see what we're doing, and we're building this legacy from generation to generation about how children do for parents after the parents have done so much for the children. One last point, Dr. Deutsch mentioned at the beginning the importance of the medical professional getting a sense of what the circumstances exactly are. Many times, loved ones see things that the medical professional might not see. It's a rather limited appointment, and the patient might not share. It's an interesting halachic question. Is it appropriate for a family member to share information with the medical professional? And I would say absolutely, as I think came up from Dr. Deutsch's presentation, the more data and perspective the medical health professional has, so much more can be done for the patient. Like with everything in honoring one's parents, we have to do it with care and respect and with an appropriate tone, and to do it hopefully in a way that doesn't embarrass the patient, maybe when the patient's not even around. But the general premise in honoring one's parents is if it's something that they need, even if it's not something that they may be happy with you at the moment for doing, it's certainly considered a fulfillment and an essential fulfillment in many cases of honoring one's parents. And best of luck to everyone. Hashem should give us all much strength. It's a very difficult chapter in life for so many, but it carries with it a great opportunity to develop ourselves as people. Thank you very much.
Thank you, Rabbi Rosenbaum. There's an opportunity, if we have a few more minutes in this program, to field questions. One of the questions that I see right now is, how do I know when I am or a loved one is being normally forgetful, like not remembering where I left my car keys and early dementia requiring medical attention? I think this was addressed by Dr. Deutsch, but it's never a bad time to remind people the difference between one thing or another. And so I will ask just a kind of a quick overview of answering that question, if you wouldn't mind, Dr. Deutsch. And then there's also another question, but I'll let her answer the question first. The questions so far have been more medical oriented, but go ahead if you'd like to address that question, Dr. Deutsch.
Sure. So, in the early stages, it's really, really difficult to always know, is this normal aging if you're watching it in a loved one or in yourself? So there's just no substitute for getting a screening examination. And that's why I highlighted that actually in the Medicare, if you're over 65 and you have Medicare, the yearly physical exam requires a cognitive screen. And that's really the place to start. It's really the most scientific way that we have to ascertain which parts of the brain are functioning, which are strong, which are weak, and it opens the door to know what do we need to do next.
Thank you. Another follow-up question I think you're in a position to answer, I hope. Do products like Prevagen or Prevagen work?
I don't know much about Prevagen, but I think most of it is really marketing. and work on what? Work on preserving memory for people that don't have dementia? I don't think so, truthfully. I think a lot of that is marketing to a very wide audience. And I think what we do have at our disposal are the, eating right, exercising, the basics, really, and that we don't need to take these supplements, or they're really supplements and they haven't been approved by the FDA. So I guess I would say no.
Thank you. The next one is probably something that Dr. Deutsch might want to feel, but the others can also weigh in, because we all have relatives who might have that kind of a situation. So it has to do with getting somebody to want to be screened. What advice do you have to convince an individual to go to the first step and walk in the door for a screening? So we can start with you, Dr. Deutsch, and anybody else who wants to weigh in on the panel, please feel free to do so. Thank you.
Well, I mean, many, some people are so nervous they actually want to be screened. So that's good. But I think presenting it that it's, sometimes you can't convince somebody. I mean, I recently had a new patient that she said, she started off saying, I'm not going to take this. I'm not going to do this test. And I said, well, you might come out that everything is good and you'll be reassured. And so finally she took it and she did fine. And so she was relieved. So I think you have to know the person that you're dealing with. It's very individual. There's no one answer of how to get through, but I think keep coming back to it. I wouldn't just accept once at one point in time. Maybe a month later, you bring it up again.
We've been very fortunate. I'm sorry, go ahead. You were saying something else?
Yeah, I was going to add to that. I hear that often in the work that I do, and I kind of coach family members. It's a few things. Number one, they're nervous, they're worried, as Dr. Deutsch said, what if I do have this memory loss? I'm hesitant, I'm worried. So what they're looking for their family is reassurance. You're worried that you might get this diagnosis. If you do get this diagnosis, I'm going to be there for you. We're going to be together as a family. I married you for, better or worse, whatever you want to say, give that person reassurance. The other thing is, what I like to do is to teach people to normalize whatever it is about ourselves, right? Look at I've used examples, look at if you had a cough that didn't go away for 2 weeks, you would go in and hopefully see the doctor for your lungs. We should be doing the same things about our brain, is the same things about our mood. I think we as a society overlook some of these things, and it's really what we should be doing. So let's just normalize and get, if you twisted your ankle and it was swollen, you'd go to the doctor for that. Let's just, as Dr. Deutsch said, let's get this initial scan and see if that can kind of relieve the anxiety, normalize it, and then reassure them at the same time.
I appreciate what you're saying, Ms. Buckley, because I think what you're touching on here is the stigma. And many of these programs that we've tried to develop have to do with increasing information and developing a sense of community so that stigma goes away and information and helpfulness and caring for each other come step in. If you don't have information, if you don't know the resources, and the information is where you start. So I appreciate that what we're trying to do here is to eliminate stigma as much as possible for many of these things that we don't want to talk about or are ashamed of. One question that I think against with Dr. Deutsch is, what do you mean by reversible dementia?
Right. So these are the other medical conditions that can look like, that cause cognitive impairment, but it's cognitive impairment that can be reversed, that can be treated. You treat the underlying medical condition. If it's an infection, you give an antibiotic. If it's a B12 deficiency, you replace that. So these are the treatable causes for cognitive decline.
Thank you.
And I'll piggyback on what Dr. Deutsch said, if that's okay. I know my father, who a few years ago, he's 84 now, fell and broke his hip and had to have surgery. And he had anesthesia with the surgery and then was put on a lot of heavy narcotics. And there was some memory loss and confusion. I want to say more confusion because of the heavy narcotics he was put on. So we took him off of the narcotics, and then the confusion and the hallucinations that he was having and stuff disappeared. So there's other underlying things like Dr. Deutsch, and we see a lot increase in urinary tract infections, which cause confusion in seniors. So if we see that in our program, we will let the families know, and getting a test for a urinary tract infection is very easy. And then you can be put on an antibiotic, and that can decrease the confusion as well too. So like Dr. Deutsch said, it's looking at the underlying causes of all these things.
Thank you very much. So we've had a great program, and we've had a very nice turnout, but other people might also want to take advantage who have not had a chance to attend or to take notes. We were asked, one of the questions was, please make available fundamental context information shared. Our plan is to pull this together in a resource list. We also plan to have the recording as much as possible at the Shomrai website. We'll also give it to Bikur Cholim to share. If it's too large to share, we might not be able to share all the recording, but we will try. There's another question that came in, and we'll try to make that the last one if possible. I think it's a Dr. Deutsch question. Any correlation between TSH levels and confusion?
Yeah.
Maybe you can parse this question for us.
Yeah, excellent question. Absolutely. If there's elevations in TSH, that really means there's not enough thyroid hormones circulating, and patients will have cognitive issues, depression, and that's really the number one thing that I always look for and make sure is done, to look at the thyroid level, because it's very common that for people to have changes in their thyroid production. So it's an excellent question. Thank you.
TSH stands for thyroid syndrome hormone, something like that? Yeah.
Thyroid stimulating hormone.
Thank you. Thank you.
And it will.
Okay, that's really great. So I think we have come to exceeded somewhat the time we set aside for this. We really appreciate your joining us, your interest. Please send us future ideas for programs. We will share the information that's collected here and the recording as much as possible as soon as we can. And until the next one. And thank you to all our panelists, really putting together a lot of thought and sharing something about this that is on a lot of people's minds, no pun intended. And also sharing your expertise that you've developed over many decades, professionally and personally. So we really, this is how we come together as a community, learning from each other, from experts, and helping each other that way. So thank you very much. And we wish you a wonderful day, and be well. Thank you. To be continued.
Thank you.
Thank you, Max.